Let me introduce research studies performed using electromyography. So I will talk about 4 EMG studies. The first study used maximal voluntary isometric contraction to normalize raw EMG value. And then the second study used submaximal voluntary dynamic contraction to normalize raw EMG value. And the third study measured fatigue using the EMG. And the last study didn't perform EMG normalization. And the title of the first study is Kinematic and EMG Activities during front and back squat variations in maximum load. In background, the squat is a multi-zone free weight and resistance exercise developing the quadriceps, hamstrings, and erector spinae. And there are variations of the squat. Depending on the position of the bar, the squat can be back squat, front squat, or overhead squat. And depending on the depth of the squat can be partial, half, or full squat. And depending on the stance width of the squat, and the squat can be narrow, medium, and wide squat. This paper compared back and front squat biomechanically. And this is a back squat, and this is a front squat. There were similar previous studies to this study that examined the biomechanical differences between back squat and front squat. However, submaximal weights were used in the previous studies. So here is the research question of this study. How do the front squat and back squat differ from each other when those are performed with the maximal loading? So the purpose of this study was to compare the muscle activity and kinematics of the knee and hip joints during front and back squat with the maximal loading. For methods, 12 males were used in this study. And then back and front squats were performed with the 1 repetition maximum. And both back and front squats, 1 RM were measured prior to data collection, which means the study used the same relative load. And 7 muscles were used for EMG activity, and vastus lateralis, and vastus medialis, rectus femoris, semitendinosus, vastus femoris, and gluteus maximus, and erector spinae. And 2D kinematic data was also collected using video cameras for this study, but we will just focus on the EMG activity in this study. And maximum voluntary isometric contraction was measured from these 4 muscles, quadriceps, hamstrings, erector spinae, and gluteus maximus. So I can call this MVIC. These MVI strains of each muscle were collected in a randomized order. And then the MVIC collected was used to normalize EMG values. And the normalized EMG values were expressed as a percentage of MVIC. And filtering, rectification, and integration were performed for EMG signal processing. And for statistical analysis, a paired sample t-test was performed. And for this test, independent variable was mode of the squat, which is the back squat versus the front squat, and dependent variables were EMG activity and kinematic data. But as I mentioned earlier, we'll just focus on the EMG activity. Result, front squat showed significantly greater EMG activity of vastus medialis than the back squat during the ascending phase. And also, the back squat showed a significantly greater EMG activity of semitendinosus muscle than the front squat during the ascending phase. This study also compared EMG activity between ascending and descending phases of each squat. And then the ascending phase showed a significantly greater EMG activity of gluteus maximus, biceps femoris, and semitendinosus muscle during the back squat, and then vastus medialis and gluteus maximus and biceps femoris, and then semitendinosus muscles during the front squat. Then the conclusion of this study. The front squat may be as effective as the back squat under maximal loading conditions in terms of the overall EMG activity. and then the front squat may be preferred over the back squat for knee extensor development and for preventing possible lumbar injuries during maximal loading. And the title of second study is Biomechanical Comparison of Self-Selected and Experimentally Controlled Speed and Ankle Width during the bench press exercise. Background of this study: speed and ankle width. These two are the primary factors affecting bench press performance. For example, also low speed has been recommended for technical acquisition, and fast movement has been shown to produce greater one repetition maximum. Also, 1RM and muscle activity changed as the width varied. Here, there has been a common methodological issue. Self-selected conditions have not been considered by many of experimental studies. Also, in the experimental conditions of speed of movement and ankle width during the bench press, a metronome was used to control the speed of the movement, and a biochromial distance was used to control the ankle width. And also, participants reported discomfort during experimentally controlled conditions during resistance exercise. Okay, here are research questions of this study. Does self-selected speed and ankle width show higher 1RM and muscle activity than the experimentally controlled speed and ankle width during the bench press? Do participants feel less comfortable under experimentally controlled conditions? And the purpose of this study was to compare 1RM and a rating of discomfort and EMG activity of the upper body between experimentally controlled and self-selected speed and ankle width during the bench press. For method, 20 male participants were used in this study. And there are 4 bench press conditions in this study: self-selected speed and grip, SS condition, and self-selected speed and experimentally controlled grip, SC condition, and experimentally controlled speed and self-selected grip condition, the CS, and experimentally controlled speed and grip condition, the CC. And in this condition, the controlled speed was determined for each participant based on their self-selected speed measured during the 1RM testing at their self-selected grip. So the 1RMs of SS, SC were first measured, and those of CS and CC were measured afterwards. For controlled grip width, 20% of biochromial distance was used. Therefore, controlled speed condition, the tempo of 2 beats down and 2 beats up was used for this study. In other words, the time measured in seconds during the 1RM testing was converted to beats per minute using this equation. 4 beats were first divided by the measured time in seconds to calculate beats per second. And then the beats per second calculated was then multiplied by the 60 to convert it to the BPM. 4 muscles were used for EMG activity. So pectoralis major, trapezius brachii, and anterior deltoid, and biceps brachii. And then some maximal volunteer dynamic contraction was performed for EMG normalization. So 90% of 1RM was used to normalize the raw EMG value. And then SV, each trials of each bench press condition was performed in a randomized order. And then the normalized EMG values were expressed as percentage of SV DC. And again, filtering, rectification, and smoothing, these were performed for EMG signal processing. Upon completion of the 1RM measurement, all the participants were asked to answer a question of what was the most uncomfortable condition among the 4 bench press conditions. This was asked to identify a rating of discomfort, which means a rating of the proportion of the participant selecting one condition as the least comfortable bench press condition. And vertical bar acceleration was also collected to explain the result of this study, but we will primarily focus on EMG activity in this study. Statistical analysis for EMG activity, a two-way repeated measures of MANOVA was performed, and independent variables were speed and grip width. The dependent variables were EMG activity of the muscles. For 1RM, one-way repeated measures ANOVA was used. Independent variables was type of bench press, and dependent variable was 1RM. And frequency analysis was also performed using the participants' response to the question. Result. Let me explain this graph first. The left, the vertical axis means 1RM. And then right vertical axis means the rating of discomfort. And then black bar graph represents 1RM. And then the line graph with the dots stands for a rating of discomfort. So there was no significant main effect and interaction of speed and grip width on EMG activities. However, SS showed a significantly higher 1RM compared to SC, CS, and CC condition. In terms of the rating of discomfort, the CC was characterized as the most uncomfortable bench press condition, followed by CS, SC, and SS condition. And the conclusion of this study, SS showed the highest 1RM value and was ranked lowest for discomfort among the 4 bench press conditions. And there were no significant main effects in interactions of speed and grip width on EMG activities. And this study also suggested that the result obtained from the experimentally controlled condition should be carefully applied to the real world. Next EMG study is about fatigue. And the title of this study is Evaluation of Surgeon's Muscle Fatigue during Thoracoscopic Pulmonary Lobectomy using intraoperative surface electromyography. And background of this study. Video-assisted thoracoscopic surgery, or VATS, has been proven to have advantages over conventional thoracotomy in terms of reduced post-operative pain and earlier return to normal function, and shorter hospital stay and reduced cost, etc. However, VATS has presented surgeons with complaints of physical discomfort, particularly in the neck, shoulder, and back. So some researchers express this phenomenon as patients benefit while surgeons suffer. The research question of this study: is EMG helpful to detect specific muscle related to discomfort in the real surgical environment during the VATS? So the purpose of this study was to identify specific muscles related to discomfort by measuring muscle fatigue during the VATS lobectomy using EMG. And 12 cases of VATS lobectomy for lung cancer performed by a single surgeon were used for this study. A total of 16 muscles were collected for EMG activity, and median frequency was analyzed to identify fatigue. And for statistical analysis, a pair sample t-test was used in this study. Independent variable was time point, which means start of surgery and end of surgery. And dependent variables was median frequency of each muscle activity. The result of this study: the final median frequencies were found to decrease from the initial median frequencies in the bilateral splenius capitis and then lumbar erector spinae muscles, indicating increased muscle fatigue. In conclusion of this study, significant muscle fatigue, which means decreased median frequency over time, was observed in the muscles of neck and the low back during the VATS lobectomy. Okay, the last study is about the no EMG normalization, which means this study didn't perform the EMG normalization, so that this study used zero EMG value. The title of this study is the comparison of free weight squat to Smith machine squat using electromyography. The background of this study. Free weights are generally preferred over machines by bodybuilders and athletes because they require a greater muscle recruitment. However, machines are easier to use by beginners than the free weight exercises. The free weight squat is one of the most popular exercises used for training leg muscles, and Smith machine squats allows one to perform a similar movement where the barbell is stabilized into parallel tracks, allowing a more stable exercise. Here are research questions of this study. Does the Smith machine squat produce a higher EMG activity of prime movers? Here, prime movers means muscles of the upper leg. Then, does the free weight squat produce a higher EMG activity of stabilizer? Here, stabilizer means muscles of the trunk and lower leg. So the purpose of the study was to compare EMG activity of prime movers and stabilizers between the free weight and Smith machine squats performed with the 8 repetition maximum. For methods, 6 participants were used in this study, and then both 1 items of free weight and Smith machine squats were measured in a randomized order prior to actual data collection, which means this study used the same relative load. And 7 muscles were used for EMG activity. For vasa lateralis and vasa medialis, biceps femoris, erectus spinae, tibialis anterior, and gastrocnemius, and rectus abdominis. And no EMG normalization was performed in this study because the data collection was a repeated measures design comparing EMG activity within individual. That's why the raw EMG data were used to obtain a mean absolute value for each repetition in 8RM, and for statistical analysis, one-way repeated measures and above was performed. And independent variables was a mode of squat, which means free weight squat versus a Smith machine squat, and dependent variable was EMG activity of each muscle. The result, the free weight squat showed significantly higher EMG activity of vestibular medialis, biceps femoris, and gastrocnemius than those of Smith machine squat. And also, in terms of averaged overall muscle groups, the free weight squat showed significantly higher than the Smith machine squat. Conclusion of this study. The free weight squat may be more beneficial than the Smith machine squat for individuals who are looking to strengthen the plantar flexors and knee flexors and extensors. Okay, this is the end of this video. So I talked about the 4 EMG studies in this video.